Okay. Good morning, and welcome to the, I don't know, which is this, our fourth, fifth, sixth Recipe for Success day-long workshop, where we get to explore one area. Last year was literacy. We were offline during the pandemic, and it is really, really wonderful to see a crowd and to see all of you here today. I'm Miriam Barry. Before I start, I really want to thank the Haddad family for this magnificent venue and for allowing us back after last year. Really, their hospitality and gracious hospitality is beyond, and we are very grateful to them for allowing us to use this and for welcoming us so graciously. I also want to thank my team. All of the volunteers. I'm not going to say who they are because I'm going to forget and I didn't write them down, so I don't want to leave anybody out, but I do want to mention my right hand, Sari Towell, and my other right hand, Barbara Sutton. Without them, we really would not have gotten this done. I also want to introduce Gloria Izon, who is now doing search in Deal. Yes, due to popular demand. Gloria can be reached through the SBH Deal main line, and she will get back to you, and you will be able to get the services that we do. So what is Search? Search is an advocacy program of Sephardic Bikur Cholim. The first thing we do is help navigate kids through the Board of Ed, whether it's the New York City Department of Education or MOESC. We can help you in Brooklyn, and Gloria can help you with MOESC. We work with the schools to help your child get the services that they need. It's different than Deal than it is in Brooklyn, but we do what we can. We run programs like this, and we run programs throughout the year. Happily, this program today is being recorded. One of the most wonderful things we do that is only available in Brooklyn right now is the Parent Engagement Center. That is free parenting, free one-on-one parenting, no copay, no insurance, no nothing. You get to sit with a therapist either on Zoom or on a phone, and you get to bring up your issues with your children, age 5 and up, and unfortunately, because it's funded by the New York City Department of Ed, it is only available in Brooklyn. But if you want that, you're more than welcome to call us. We have 3 therapists working. Sometimes there's a drop of a wait list and a little bit of a wait time. Can I introduce our panelists? Okay. So Oh yes, follow us on Instagram, search SPH_search, okay, and you can see all the things. We also post a lot of educational stuff and links to other educational things and all the stuff that we're doing, events and so on. This is actually our 3rd event of the summer. We had Barbara Listhouse several weeks ago, and we also had a toddler screening. That's something that we hope to do again next year, and that's, if you want to know if your children are okay, whether you need to follow up or whether you can go home and sleep peacefully. Okay, so we have a lot of questions about why my child needs therapy. How am I supposed to know? The school says my kid has sensory. The school says my child has language issues. The school says, the school says, the school says. Many of the pediatricians are not always seeing it because they don't see the kids in action. They see them, once a year or once every 6 months. And so, how am I supposed to know what my child needs? And we get that question all the time. Yeah, I went to the thing, they gave me OT. I didn't do it. I didn't think there was a problem, but now my kid is being thrown out of kindergarten. What do I do now? Oh, maybe your kid did need it. So we got this panel together to understand what it is, what these therapies are, and why we recommend them, why the school tells you, why you may notice things. And I just want to introduce my distinguished panelists. Okay, and I'm just going to do it like this because, okay, we have Natasha Serure, who's an LCSW. We have Laura Kurtz, speech pathologist. We have Stacy, Derzie, special educator. And Rivky Teitelbaum, she is an occupational therapist. And they each have their specialties, but what's wonderful about this panel is every single person can benefit from the knowledge of all of our distinguished panelists. Please look at their bios. If you have any questions, they are available, and I'm just going to hand it off to Barbara. You got it.
You can give that one to the distinguished panelists.
Okay.
Thank you,
so
Miriam,
much for
and
coming.
thank you, everybody. Thank you to Miriam for doing what she does day in and day out. Miriam is amazing. I am so excited to be here this morning, seeing everybody's faces and getting ready to discuss the amazing things that we have to talk about. This is really a dream come true. One of my goals and one of our goals here at Search is that every parent really leaves feeling empowered to be their child's best advocate and voice in this world. Because if they don't have us, who do they have? And how am I supposed to know? Guess what? You're not. Being a parent, being a mom, never comes with a manual. You're not supposed to know. Don't worry about it. No pressure. We're also here to help. This is what Search does. We take phone calls all the time. We answer questions like, how am I supposed to know? What am I supposed to be doing? And we said, we get these questions all the time. Let's turn it over to some of the professionals, ask them some of these questions, and answer them for everybody instead of a bunch of different times. So here we are with Natasha and Laura and Stacy, thank you. I'm sorry, I'm nervous.
We all are.
I'm Rivky, okay. So the first thing I want to do is I want to have everybody introduce yourselves, talk a little bit about what you do, how you help the community's children, and if you can also just describe a typical day in your caseload. What does that look like for you?
Okay. Hi, my name is Natasha Serure. I work in schools and have had a private practice for over 15 years. I coordinate with psychiatrists, other therapists, doctors, and teachers to find the best solution for their child and the source of their problem. I help children on a day-to-day basis with anger management problems, social issues with social skills training, ADD, ADHD, behavioral problems, conflict with peers, family problems, anxiety, depression, kids on the spectrum.
Hi everyone, I'm Laura Kurtz. I'm a speech-language pathologist. I'm also a mother of 4 boys. I've been working as a speech therapist for the last 15 years. I've had both private clients and I work in the schools within the community, and I work with both early intervention and older children. A typical day, looks like having babies who are working on expressive language and receptive language, as well as 4- and 5-year-olds who need to work on social skills, language, following directions, kids with ADHD, auditory comprehension. I work with older students and younger students who have articulation difficulties, and the list goes on and on.
Hi, my name is Stacy Derzie. I am a special ed teacher. I work doing EI, CIT, MP3. I work in the community schools. I currently do a lot of CIT with 3- and 4-year-olds. I am a mother of 4 children. I work in the classroom and out of the classroom. A typical day would be, I see children in hour increments, so I would see, depending on their mandate, if I see them for 2 hours a day or an hour a day. It all depends on their mandate, and I see children throughout the day. I see children also privately on the side, and
Talk about what you work on.
so I do work on learning disabilities. I collaborate a lot with the PT, OT, and all the other therapists. I work with attention during circle time. I work with socialization skills, social and emotional, more specifically like conflict resolution, and depending on what the IEP says is exactly what I go by, depending on the child's IEP, ADD, and everything that they said also.
Hi, I'm Rivky Teitelbaum. I'm an occupational therapist. I've been working in pediatrics for the last 15 years. I've worked in preschools, elementary schools, special ed, regular ed. For the last 11 years, I've been privileged to work in Gesher Yehuda Yeshiva in Brooklyn. And for this coming year, will be my 5th year as the Director of Related Services. To describe a typical day, I really just work with normal, regular kids who are feeling challenged in the classroom. Sometimes it's related to their ability to pay attention. Sometimes it's coming from a low tone, poor endurance, so they're weak and unable to hold themselves up properly within their desks, which manifests themselves as being a little bit fidgety or having difficulty sitting. Sometimes it's handwriting that we'll hear from the teachers that it's not as legible as it should be, or that needs some help. sometimes it's reading difficulties that are coming from issues with their ability to track and their eyes to work together. So we will work with kids who are having these challenges and try to figure out as detectives what the source is and then address it from its roots so that we can help them to function to their optimal potentials.
Thank you, everybody. There were certain things that I heard in there that stood out to me. Laura, you said you help kids with their social skills. That's very interesting to me because speech therapy, I think of like a lisp or a stutter. Social skills, it's a very interesting thing that I didn't know necessarily that a speech therapist may work on. Stacy, you said something similar, that you help with conflict resolution. Sometimes kids have a hard time expressing how they feel and really working out issues with their peers or teachers or whatever. So that's amazing that that's something that you do that a child may need services for. And Rivky, you summed it all up, which was amazing that she was at the end. She said, I work with regular kids who just need a little bit of extra help and they're feeling challenged in some way. So that was amazing. In thinking about your caseloads, I think it would be helpful if we talked about how the parents reached you. How did most parents find out that their child needs therapy?
So for speech therapy, oftentimes when a child is little, baby age, if a child is having trouble speaking, understanding, anything like that, a parent will reach out to a speech therapist. But when you hit the school age, oftentimes a parent, when they compare their children to other kids their age, if a teacher or school mentions that there's an issue, if your child's entering 1st or 2nd grade and struggling with reading, attention, following directions in the classroom, anything like that that leads to difficulty with homework, will lead to a parent thinking that their child needs some kind of help.
Currently, I'm doing a lot of See-It. If a child already receives EI services, sometimes it does translate and go into See-It services. I am in the classroom, so a lot of the times the teachers see a month, 2 months, 3 months into the school year how that child is doing. And then they would just go from there and maybe talk to somebody within the classroom, within the school, and double check, reach out to the parent, and they would say that your child might need services. Again, they're with the child all the time. I would definitely listen to the professionals. It's something that you should definitely question, you should definitely ask, you should definitely come to the team at Search. But they're with your children for 6 hours every day, and they're with 20 children in the same age group. So they're able to see what they are doing, what they aren't doing. Are they completing a task on time? Are they answering questions in circle time? Are they picking up on the concepts that are being learned? How are they socializing with the other peers in the classroom? Are they playing alone? Are they playing together? So these are things that the teacher sees on a daily basis, and I would just trust what the teacher says and what the school says.
So most parents seek out a therapist when they're feeling stuck, overwhelmed, or very worried about a child's behavior. Other times it's the school who recommends it because they're experts on children and know the norms and what stands out as abnormal or unusual. Another referral I get is from the Board of Ed. When they evaluate the child for academic difficulties, they'll see that there's something holding them back for optimal learning, whether it's social skills, overly anxious, and so they'll make a recommendation for counseling, and that's how I see kids in school, those with counseling mandates.
Thank you. I think it's interesting to hear all of the different places where parents can be informed that their child may need therapy, whether it starts in early intervention or in the school age, and we need to think about listening to the teachers and really being aware. And for Natasha as a counselor, just understanding that maybe some sort of emotional thing is getting in the way of their academics. So that was very interesting. Thank you, everybody. So leading into that, what do you think is the most common misconception about your therapy? I think parents have different thoughts about things. What do you think the most common misconception is? What do you think parents need to know? What do you feel they don't know?
So I think people have thought back in the, for a long time that therapy means your child has severe issues. They're crippling anxiety, severe depression. Nowadays, the thought has changed, and we know that early intervention is key. The sooner you address a problem, the better the results, the faster the results. And many times, especially in children, typical problems don't appear like they would in an adult or a teenager. So a child may be experiencing depression or anxiety, and it appears as if they're extra irritable, impulsive, aggressive, or they just can't manage their frustration and things linger, so something upsets them and they just can't get over it so fast. Those are all things that could be addressed in therapy.
So as Barbara mentioned earlier, the common misconception about speech therapy is that it's specifically for someone who has difficulty with expressive language, if they have a lisp. That's just the tip of the iceberg. Speech therapists can also focus on auditory processing, executive function, memory, word recall, swallowing, feeding, play, social skills. There's such a range of things that speech therapists work on. The important thing is finding a therapist who focuses on the aspect that you need and the difficulty that your child or even an adult is having. Because there are many therapists out there, but the key is finding one who specializes in that specific need.
I would think a specific misconception in my field, in my area, would be that, they're just playing games with my kid or something like that. However, a lot of these games are educational games. Some of them might not be educational games. They could be anything from Candyland to Zingo. So we do sit and play games with your children, and while we play the games, these children have increased communication skills. They have a person that they could talk to, someone safe that they could be with, talk to. It's in the classroom and out of the classroom. So they're learning conflict management, they're learning emotional regulation, they're learning speech skills, expressive language skills, receptive language skills. There's a whole slew of skills that they are learning through playing games with your children.
I'm actually very excited to be able to answer this question because my number one pet peeve is that people, and understandably so, just assume that when you get OT, it's to work on handwriting. And to be perfectly honest, I can probably count on my fingers how many times I've actually worked on handwriting. Because the honest truth is, even if a child is being referred for occupational therapy because they are struggling with handwriting, in essence, the challenge that the child is most likely grappling with is much deeper than the handwriting. It doesn't have to be anything major, but you want to tackle the source of why the child is struggling with the handwriting. Is it that the child might just be low tone, weak muscles, strength, and poor endurance, and just need a lot of core strengthening to help them to be able to function to their best ability? They use a term in the courses that we take which says proximal stability for distal mobility, that if you want to be able to be successful with your fine motor skills and your finger strength and your hands, you need to have a strong base, so you need to be very strong in your core. So we'll do a lot of heavy work activities to strengthen the core, and then almost by magic, automatically, I will get feedback from the teachers in the classrooms that, wow, they've seen incredible improvement in the children's handwriting. This was with me doing no actual work on the handwriting, but really just correcting the core of why they're struggling with handwriting. Sometimes the issue could be visual perceptual, visual motor, how things are perceived with the eyes. It could be a challenge in terms of crossing midline. There's so many different aspects, and you really just need to get to the core as to why they're struggling and address it from the roots. Sometimes they will need a little bit of practice because they may have missed the time period when the handwriting was actually being taught because they were struggling with these underlying challenges that were keeping them from being able to grasp it in the way that would have been expected at that age. But if you really correct the source of why the child is struggling, the actual practice will be 1, 2, 3, and it will be something that the child will enjoy because it will no longer be grappling with the root of what was keeping them from being able to do so, and it will be a positive, successful experience. So really, in most cases, no OT should only be working on handwriting. They should be working on the underlying pieces that are preventing the child from being able to have the proper handwriting.
I'm just writing that down. Well, I don't have to now because it's my turn. That was a very important thing that she said. There's no OT should only be working on handwriting, and that goes back to what I was saying earlier about you being your child's best advocate and voice. If you feel that your OT, if your child gets OT and you feel that they're only working on handwriting, it's important that you speak up and say something. I heard a few things that I wanted to highlight as well. Natasha, you mentioned that it doesn't have to be something so big. It could be something small that's just getting in the way of learning at that particular moment in time. It doesn't have to be a diagnosis of depression or something. That was very interesting. Laura, I wanted to also highlight, you mentioned things like word recall, and organization of thoughts, and about finding a therapist that focuses on that need specifically, memory, or whatever it may be. And I want to just take a quick second to talk about how we at Search can help you find that and make that match. We have a database of therapists and their specialties. So if you're looking for something specific, please reach out to us. We can match you with the perfect therapist for what your child needs. And Stacy, don't kill me, I have a follow-up question. Okay. It's not in the notes. One thing, so I've been a classroom teacher for a while. Don't worry, it's okay, it's fine. You mentioned it in the meeting, in the prep meeting, it's fine. She'll be fine. A lot of times parents will reject a C.Ed or a P3 because they feel like it's a crutch, right? Like my child, I don't want my child to have it. They're gonna need you all. Like it's gonna be a crutch for them. Like what would you have to that? Because that to me is a misconception. What would you have to say about that?
I think it's a lift. I call it more like a lift. We're trying to elevate your children. We're trying to be there for your children. I'm there so that your child could express their wants and their needs. I don't think a child might always need it. A child might not need it forever, for their whole life. They might need it for a year or two, then they might not, then they might again. I think that it's important to realize this is a positive thing, and we're all here to help your children, and we're all here to work as a team, and we're here to empower you and to help you and your child succeed. And so I believe that it's like a whole team working together to help that child. And it's okay, whether they do need it forever or they don't, it's fine. Should I continue?
No, that was perfect. That was fine. Because we could talk more about it afterwards. Don't worry. And Rivky, I had a follow-up question for you because I think a lot of people are not totally sure what OT entails. Can you talk a little bit about the differences between OT and PT?
Sure.
So this question is also a favorite because I'm asked this all the time, and quite understandably, if you're not in the field, it does appear that OTs and PTs do the exact same thing. So to clarify the differences, PT's main focus and goal is to help promote movement and reduce pain. So in both adults and in pediatrics, if a muscle is weak, the professional physical therapist is going to work one-on-one with the child or in a small group and help to strengthen that muscle, whether it's the upper extremities, the lower extremities, the trunk, the core. If somebody had an injury, they'll work on reducing pain and helping them to be able to be functional using that limb or specific muscle in the body to their maximal potential. Now, OT, for all who might not know, stands for occupational therapy. The goal of an occupational therapist is to help the person who they are working with be able to do their quote-unquote occupations to the best of their ability. So in an adult, if somebody had an injury, let's say they hurt their knee or had a knee surgery or hip replacement, the PT will work on strengthening the muscles that were weak, and the OT will work on helping that person be able to accomplish their life roles independently. So depending on where they are in life, if you're a mother, If you work at a job, they'll make sure that you're able to be independent. So they'll help you with whatever you might need to help you with dressing, any like compensations like stock aids for anybody who's ever had surgery or an injury. They may be familiar with these kinds of things. They might be working on the same thing as a PT, like a PT is working on their standing ability, but they'll be doing it for a different purpose. They'll be doing it so that they could be able to stand on their feet to cook for their family. In pediatrics, it works the same way. The role of a baby is to play. I wish we could all have that role at this point in our lives. And for a school-age child, it's to be a student. So when an occupational therapist works in a school, their primary goal is to help that child be able to perform their occupation as a student to the best of their ability. And therefore, if a child is in a classroom and having trouble doing their job as a student, for example, and this I actually waited for this question to be able to mention, there's a huge realm in occupational therapy that works on sensory processing. That's personally my baby. And it's such a huge part of our overall functioning. So many times a kid may have trouble focusing in the classroom. They may disturb in the classroom. They may just be zoned out and in their own world. And it's not necessarily at the roots of a cognitive issue, but rather it's challenges with sensory processing. They either can't filter out the extraneous noise. So for example, if they're sitting at a window or near a door, it would be advisable for the OT just very simply to recommend that they sit closer to the teacher at the front of the room to have less distractions. If they have difficulty sitting, sometimes using one of these cushions that you put underneath, which give a little bit of extra deep proprioceptive input, or TheraBands on the bottom of the chairs, which we put in all the time for their feet to rest. Sometimes even just Velcro on the desk could do the trick. You could put it underneath so no one sees, and they can just use it as like a little fidget for some tactile input. But there are so many little tricks that when it's picked up on and instituted, it can make the world of a difference for a kid to be able to function in the classroom. And sometimes children are also struggling with reading, and it's not necessarily the fact that their core issue is in their cognitive ability to read, but rather it's in their eyes being able to work together. That's another huge passion of mine. And in Geshe Yehuda, where I work, I actually work very closely with our reading specialist, who's phenomenal. And if she sees that she's reached like a block with a child, that she's just not like, the kid is there and focused and learning, but there's something's not penetrating, she'll come to me and we'll try to brainstorm. Sometimes it could be that they just need a slant board to put the book on, and then when it's closer to their face, just their ability in terms of being able to see and accommodate near and far distances is challenging. That would make the world of a difference. We also have a Hebrew reading specialist who works with children, and I noticed with one particular child that he was struggling, and it seemed to me that the root of his struggle was because he has difficulty crossing midline. And if we just positioned the Kriya book that he was using to a different point on the table, it eliminated that challenge, and he could put all of his energies into learning to read. So many times it's just small little tricks of the trade that you're not necessarily in tune to unless you have that professional training that could really make it or break it for these kids and be that key in helping them to be successful. And often a challenge that presents as an academic struggle might not be rooted in an IQ or a cognitive challenge, but it's these other aspects that are influencing the picture. And if we just pinpoint where they are and what they are, and we address it as early as possible from the source, we can make such a world of a difference in helping our kids just be the best that they can, and also that they shouldn't be misunderstood. Because so often you might think a child is disrupting the class, but it's really just because it's so hard for him to focus, or the noises in the classroom are so irksome and overwhelming that he just needs to regulate himself, and it sometimes comes across in a way that might not be socially acceptable, but really if we figured out what it was and we helped him with it, he would be as successful as he possibly can.
Thank you so much. I think it's important to note that small classroom disturbances or even large classroom disturbances, if a child seems behavioral, it might be a sensory issue. I know personally my daughter in a general ed school was having issues, and a couple of these little modifications, sitting on a cushion or putting a little band on, or I like the Velcro idea, that was awesome, because I feel like any little any child can sit and just, get that input and then be able to function in a classroom normally. So it's amazing to just understand these little things that an OT can do in a school to just make a child be, exceptionally successful. So thank you so much for that. I want to just go back for a second to talk about children and needing therapy, because like I said, these accommodations happen, but will they always need this therapy? How do you know that your child's therapist is a good therapist or the right therapist?
So back to that, I basically get an IEP on the child that needs services, and there's a set of goals there, and basically it could be social goals, it could be academic goals, and depending on that. So my goal as a CCC therapist is to try to reach those goals alongside with everybody else. Once they do reach those goals, then I will reevaluate and reassess that child, and the IEP needs to be updated, and that's very important to see. Do we have newer goals now for that child? And then we'll see, do we accomplish everything? Will they be able to learn by themselves, or do they still need a little bit of help? And that's to determine. What was the second part of the question that you asked?
It was, how do you know that your child's therapist is a good therapist?
So I like to see that the therapist should collaborate with the mom on a daily basis. The therapist should have a great rapport with your child. You could actually ask your children. The children today do talk about their therapist. They'll be like, oh, I'm going with my speech therapist right now. And they'll talk openly about their therapy. Oh, my brother has therapy. They're very open about it. And so if your child comes home and talks about their therapist and they have a good rapport together and they're clicking, which sometimes they could click and just get along great, and sometimes they don't, which is fine. But and you could advocate to switch your therapist. That's fine. That is totally fine. And you could get it from feedback from the teacher, from the principal of the school, or the head of the early childhood, and from the child. I think you would know and get a great idea in that respect.
Thank you.
So in general, most therapy is short term. I'd say when a child is feeling better or functioning better, that's how you know they don't need it anymore. A lot of people come back if a crisis emerges and they need help figuring out a new problem. But a good therapist really gives your child the tools to solve similar problems in the future. In general, also, a good therapist is one that jives well with the client, the child, the parents, and the school. There needs to be a level of trust between the child and the therapist, and the parents and the therapist. And a good therapeutic relationship is really part of the healing process. How the child gets along and trusts and feels safe with the therapist is part of the solution.
Thank you. Just key points that I heard is that the therapist is going to give the child tools to be able to function and to take on challenges as they come up later on. And that it's okay if they end up needing like a tune-up or something like that if a crisis comes along. And another thing is the collaboration with the parents piece. Personally, as a mom, I've been on the side where I had therapists call me once a week, once a month. Here's what I worked on with your daughter today. Here's what I worked on with your son. And then I've had therapists I haven't heard from all year. And it was like, my kid's getting OT, And that's a good gauge. And I think it really all comes back to you being the advocate. You know your child gets OT, call up the school. Who's my child's therapist? Can I speak to them? Here are the goals I'm working on at home. What are you working on in school? Is it just handwriting, right? Now you have these questions that you can ask and be more informed. Like I said, you are your child's voice and advocate. So that's a big thing.
I think she just said it's basically we're trying to teach your children the skills to become independent, and that's very strong. That's something that I really believe in. So all the skills that they're able to learn, that they're able to socialize, that they're able to express themselves and feel confident to express themselves. So it's basically like they did say, but we're just trying to teach them the skills to become independent. If they are great, and if they still need the lift, then that's fine as well.
So I just want to add to that, a good therapist will also not only be in touch with you, but will give you follow-up things to do with your kids at home. And it doesn't necessarily mean sitting down and giving them worksheets. For an OT, from even a like speech therapist or P3, the social skills aspect. What can you do? How can you even play with your child and incorporate some of those skills into everyday activities? I think is a very big thing, because as parents, we want to do the best for our children. And when you're constantly stressing about what's going on in your child's life, when they have delays, when they have anything going on, it does worry us and it can affect your relationship, but we have to remember that we are moms first and we want to enjoy that time with our kids, and we want to make sure that the time we are spending focusing on those specific skills is effective. But you don't want to constantly be like, we have to do this, we have to do this, we have to work on the handwriting, we have to work on your speech, your artic. It's not all about that. It's also about the relationship, and it's about the rapport you have and making sure your child feels comfortable, not just with the therapist, but with you as a parent to carry it all over.
That's such an important point. I'm so happy that you shared that. There's another thing I wanted to ask. We get a lot of phone calls from parents who ask us our opinion. They'll say, well, the school says that my child needs therapy, and I don't know. I don't know if I think. So when the school says that your child needs therapy, do we need to take that seriously as parents?
Yeah, definitely, yes, definitely listen, definitely ask questions, that's fine. Go for a second opinion, that's okay also. Ultimately, you do know your children, but I would say that there are definitely different demands of your child in the classroom setting than there are in the household setting. So where you might, things might present themselves differently in the classroom than they do at home. So the demands are different.
I also agree that we should trust the school, as they are experts in children, and see them in a much greater amount than we do. We have 3, 4, 5 kids we could compare to. They have hundreds. I also would say that sharing pertinent information or being aware of certain changes in the family is very important. If a child's acting differently suddenly, stop and think, was there a change? Was there an illness? Was there a separation that the child might be impacted? I also would say the first thing before you do anything is rule out something medical. I can't tell you how many times I've seen personally and with students a physical illness, nothing serious, but something, a virus, an infection impacts their behavior in school. I have one example of a student who was, suffering a little from frustration tolerance. Something would get her upset and her whole day would be ruined. And then suddenly the teachers came up to me and they said, we think something got worse. She's going to the bathroom every 20 minutes. She must be experiencing a lot of anxiety or is feeling overwhelmed by the academic demands. And the mom called me as well, very nervous, and I said, okay, before I work on her, check her out. It might just be a UTI, and she's going to the bathroom because of that. And the mom was like, okay, I didn't think of that, and she went to the doctor, and sure enough, it was a UTI, and within days, the problem was resolved, and it wasn't a big issue. So going to the doctor first is critical.
Yeah.
So just adding to that, as a speech therapist, I've so often seen children who have difficulty with their expressive language, and the underlying problem is that they need tubes. They're not hearing correctly because of wax in the ears. There's so many aspects that need to be taken care of first. You have to go to the doctor. You have to rule out hearing issues. You have to rule out vision issues. Any tongue or lip ties that could affect articulation or feeding. There's so many little aspects that doesn't mean it's going to solve the problem completely, but you need to start that. You need to eliminate out any of those underlying medical issues in order for therapy to be the most effective it could be.
So one big aspect that I would love to add on to that is that the number 1, 2 things, as Laura mentioned, that we want to rule out whenever there is an academic challenge before seeking out any other services is hearing and vision. And when it comes to vision, one thing that is not commonly known is that you can go to an ophthalmologist to look at the way the eyes are seeing, and you can look at your child's acuity and see if they need glasses and if they're seeing properly. And that is a number one thing to rule out, no question. But what most people are not knowledgeable about, and I honestly only first became so knowledgeable about this after working in the field and seeing for myself the unbelievable difference that this can make, is that you really also want to see, once you've established that the eyes are seeing properly and the acuity is okay, that the eyes are working together properly. And that is something that needs to be evaluated by a developmental optometrist. Many times, just there are different schools of thoughts, ophthalmologists, even very reputable and top in the field, will tell you they're seeing fine, don't worry about it. That they don't really necessarily think according to the therapeutic lens as much as a developmental optometrist does. It's just different trainings. And a developmental optometrist will be able to determine whether both eyes are working properly together, and that can have a major effect not only on reading, but also on ability to focus. And one example that really comes to mind is that we actually had a child at Gesher Yehuda that we worked with, and he was working with top professionals in the field on reading, speech therapy, and all the different disciplines. And everyone came back with the same feedback that we're just hitting a brick wall. Like, we don't seem to be able to penetrate and make the proper progress with this child. And there were aspects in terms of the way that he made eye contact that did raise a red flag. I spoke with his mother, and I recommended that he go to a specific developmental optometrist who I've worked with very closely and who was phenomenal. And I will give the name to search so that if anybody wants that recommendation, I would highly recommend this person. And he went to her, and she recommended prism glasses for this particular child. There was a difference of night and day within a short period of time. He got it over the summer and came back this past year. And the level of progress that he made and the feedback from the same clinicians who had worked with him the year before was mind-boggling. And in fact, he lost his glasses for a specific period of time, and all of a sudden I was getting feedback from the different therapists working with him that something's off, he doesn't seem to be himself, and we discovered that he had misplaced his glasses, and once he came back, it resolved itself. So for certain children, it's crucial, and it's not only for reading or focusing. Sometimes even children may have difficulty in their balance, and you'll notice a pattern of toe walking. And sometimes that is related to gravitational insecurity, which comes from challenges in the sensory realm. But there are children who it may come from a visual aspect where the field of vision is altered and the way that things hit their eye is different, and therefore they feel more grounded and in balance by toe walking and kind of looking up, because to them that's seeing the world upright, and giving them a pair of prism glasses makes that world of a difference in helping to bring those toes down, which you'll see immediately. I've also had experience working with students and seeing that, and it's really mind-boggling. So you just want to go to a reputable developmental optometrist who has this knowledge. The particular person that I've worked with closely does not have, it's not like a one-stop shop. Like, you go, okay, try prism glasses. She really individualizes it to the child, does a very thorough assessment. She's very down to earth and practical. She's not going to say, oh, you need to go for vision therapy unless she feels like it's really necessary, and if it's practical, it makes sense for where the child is currently functioning and what his other challenges are. So you just want to always be with the right professionals, getting the proper guidance, and Search is really here to give that guidance and make sure that we're just all detectives in the puzzle, getting to the root of why this child, who's so delicious and so normal and so regular, but is just having a slight struggle in either a specific area or a variety of areas, and pinpoint it early on so that we can make a lasting difference.
Thank you. That's so informative, because I feel like, yes, we should be taking it seriously when the school says that the child needs therapy, but that doesn't necessarily mean that the child needs therapy, right? We should take it seriously and use it as an excuse to start doing our homework and asking the right questions, like, is this consistent? Does it happen all day long? Does it only happen in the morning? Is it happening during Hebrew time or English time, or both? And then going to the pediatrician and asking about viral infections or bacterial infections, and then ruling out medical things like tubes, or with the developmental optometrist, which is a new thing that I didn't know about, which is very exciting. I love learning new things. The answer to that question is, do I need to take it seriously when the school says yes, and it's an invitation to just begin doing your homework. So I love that. I feel like that answer alone empowered everybody over here to do different things. So we did discuss, I guess, what parents should be aware of before pursuing therapy. However, what happens if we go to the pediatrician and we say, the school says my child needs therapy, they're a little behind, I don't know, something feels off, and the pediatrician's not worried. The pediatrician says, don't worry about it, it's normal. But I still think something's wrong. What do I do then?
So I think you really always have to just trust your gut as a parent. As parents, we are very in tune to our children, and we do have a good intuition and gut feeling. If the pediatrician says that it's normal and you feel like something's off, don't just stop there. Everyone has a different school of thought. Everyone has different training. The pediatrician could be extraordinarily reputable, and you're going to him as your pediatrician because of his expertise in medical knowledge. But not every pediatrician is going to be as knowledgeable in the realms of each therapeutic discipline because that wasn't his training or her training. Their training was the years of medical school that they went to, which makes them an expert in the field of medicine. But the field of development and therapeutic intervention is constantly evolving. There's so much that's out there. There's so much that we as clinicians keep learning. As a parent, you go with your gut feeling. You can have a beautiful, wonderful relationship with your pediatrician, but you have to do what you feel is best for your child. You are your child's best advocate. Often you're your child's only advocate. I mean, everyone working with the child always cares about the child, but there's nothing like a mother and the feeling that a mother has for their child. And you don't need a pediatrician to give you that green light to follow through. Sometimes people will call me and they'll say, what do I do? My pediatrician thinks I should wait, but I really do feel like something's wrong. It's fine for you to ask for an evaluation. You don't need your pediatrician's permission first. You can be respectful, but you can call up on your own, you can call search, you could reach out to whoever it is in the school that's the liaison that you can speak to, the DOE. Sometimes they'll ask for a prescription for the eval, but then you could explain, you know what, I just want to cover my bases and be absolutely sure. And to be honest, the process takes a very long time. When it comes to the DOE, it's not an overnight thing. For anyone who's staying later, when it comes to EI, you'll hear about that also, but the process can schlep for months. Somehow it seems to still be related to COVID, that everything's just backlogged, and it can take a whole year to get a child officially approved. So you have nothing to lose by going along the process. If things correct itself, that's wonderful. You don't have to then take that next step. But even to go for the evaluation could be a wealth of knowledge. The clinician could give you advice or recommendations on what to do in the here and now until you get to the point that you're having your official meeting and seeing if you're eligible for approval. And even if the clinician doesn't think when doing the evaluation that the child needs this specific discipline of therapy, they might have another recommendation of something to rule out or to check into, or a different mode of intervention that might be helpful. So you have nothing to lose. We are so privileged to be living in the New York, New Jersey area where we have this so easily at our disposal. This doesn't exist in other states. It's something that you really have to pay for out of pocket. You have to go for private therapy. Sometimes they'll do it through insurance, but it's a completely different system. People move to New York and New Jersey just to be able to get services. People stay here in order to be able to benefit from the services. So we're so lucky to have this gift. And to be honest, and I really could relate to it, when it's your oldest or your first child who needs therapy, there's a feeling of panic inside. We all want to believe that our children are perfect and they're just like us and everything's great. And you feel like, oh no, is there something wrong with them that they need therapy? So at this point, it's almost like a joke because it's so prevalent and out there that it's just the norm, the way kids talk in schools, or be like, I'm going out with my speech therapist, I'm going out with my social worker. It's no one thinks twice about it. In our day and age when we were in school, it was a very personal thing. It was few and far between. Now it's the norm. And we're so lucky to just have a personal trainer at our disposal, free of charge. You could get top people who will work with our children and help them to be the best they can. The earlier that we tackle it and address it, I can't even stress how unbelievably invaluable that is. Just the way that God created us, our brains are wired for change early on as the brain develops. The earlier you get any mode of intervention and strengthening, the quicker you're able to internalize that and carry it over and have long-lasting effects. They say if you want to teach a child a different language, the best time to do it is when they're young, because our brain is just so receptive to learning. It's not that it's not possible to do it later on, and whenever you notice that a child's struggling, we want to jump on it, but the earlier that we pick up on it, the most beneficial it possibly can be, because it just makes it so much easier for the child to make the change. And it's earlier on, it's before they've formed habits that may be hard to undo, it's before their self-esteem may have been affected, and it's really just to our greatest interest to jump right in as soon as we notice something, address it. It doesn't mean there's anything wrong with the child, it's just really helping to make our treasures as beautiful as they possibly can be, and we're so lucky to be privileged to have these gifts of people who are out there helping to strengthen our children's talents and making them the best people that they can be, which is really all that we want for our children.
Amazing. I'm really just hearing that, you guys as parents are the number one advocates for your children. You're sometimes their only voice, and if you feel like something's wrong, don't let anybody look you in the face and tell you it's not. And if you're not sure, or if you want support, or if you want to talk it out, we at Search are here for you for that. That's what we're here for. If you're not sure if your child needs therapy, we're here for you. If you're sure your child needs therapy, we're here for you. If you don't know what's going on, okay, great. Just making sure everybody knows that. There's really nothing like your intuition at the end of the day. So I just want to thank the panelists, unless anybody has any last words or things that they wanted to mention. Amazing. I'm so happy that everybody was able to make it today. Thank you, Natasha, Laura, Stacy, and Rivky for a very informative discussion. And they're here for your questions.
Do we have a few minutes for questions?
I don't know if we have, I was thinking do you want to walk around?
Okay, we will. Okay, you guys will hang out a little bit, and so put on your tags. I forgot to mention that we also have a summer homework club here in Deal at I hear a chuckle back there. For $10, you drop your kid off for an hour. We give them pizza, and we have volunteers helping them with their homework. You know how your child shows up on August 23rd with that big folder, or that that laptop that says, or that tablet that says, "Oh, mommy, I have all this homework to do." Please, we have one tonight, we have one next week, and I think we might have another 2. Okay, watch our Instagram. We have a few more weeks of homework club. You have to sign up, okay? You have to sign up. stowell@sbhonline.org, but you can just check our Instagram. Please send your child to homework club. It's a lot of fun, and they also leave with a prize. We have lunch available for purchase if you're interested. Not stupid. He doesn't need therapy. My daughter is very smart. I don't know why they're telling me. My kid is normal. Why are they saying this? So I think I could probably speak for all of you when I say that most of the children who are eligible for therapeutic services are really quite intelligent. And I imagine, as I see you, you have seen some of the most intelligent children, but it's like if you need glasses, you could be the smartest person, but if you can't see what you're looking at, or if you can't hear what you're hearing, you can't really reach your best potential. So it's never an indictment that if your child needs therapy, it's never an indictment of their intelligence, because I've looked at IQs of kids and I've been blown away by some of the kids who are amazingly intelligent with crazy scores and yet are eligible for therapy. So that's just another takeaway I really wanted to mention. I want to thank you guys very, very much for coming, and everyone